and editor of Pan-African Newswire, Abayomi Nweke, joins me now for more. Good to have you join us, Abayomi Nweke. As we know now, the United States is the epicenter of this outbreak with over 70,000 deaths. And President Trump is saying that, look, the task force would wind down in coming days. What would be the implication of that?
It's not good. We're still suffering immensely in the United States. 1,000 people every day are dying. More and more people are still being infected. If you look at areas like New York, Detroit, where I am, the curve is flattening. The rate of infection has slowed down. The number of deaths have slowed down. Nonetheless, in other states where they do not have as strict enforcement of social distancing and wearing of masks and lockdowns, we see a rapid increase in the number of cases. For example, in Texas, that is a situation, particularly in rural areas. In the South, Georgia is another good example. In the southwest part of the state, huge outbreaks that are taking place right now. People don't have access to hospitals, to physicians. They work in industries where the risk is extremely high, particularly in the meat processing sectors. So this problem is by no means over, and I think it's a mistake to even suggest that we should go back to what is considered normal at this point.
So you're listing all of these challenges in the response by officials to this pandemic, and yet President Trump also said that the country will move into the second phase of its response to the outbreak. What does that mean? What does it entail? What more can you tell us about that?
It's not clear what the president is really thinking. Initially, he downplayed the threat of the COVID-19 virus. After it had such a devastating impact on the national economy, he set up the White House task force. They had been doing daily briefings to the media. That became a political problem for the president. They have virtually stopped those daily briefings. And I think he's concerned because he has to run for re-election in November. There's been 30 million people rendered unemployed over the last month and a half. His campaign thrust was that the U.S. had a low unemployment rate and the stock market was accelerating. You can't say that now. The stock market is not down as way it was 2 or 3 weeks ago, but still people are out of work all over the United States and people are still losing jobs. So I think it's a conflicting message that the president is sending to the people. And if there's a second wave of outbreaks, it's been predicted by the infectious disease specialists, it could even be worse than what we've seen over the last 8 to 9 weeks.
I mean, these are the challenges, all across the world as leaders continue to look for how to balance lives and livelihoods. But a latest study has shown that the death toll in the United States could hit 134,000 in early August. Is there any sign that officials in the U.S. are preparing for that?
The problem is the government is divided. You have the House of Representatives in Washington that is dominated by the Democrats. You have the Senate that is dominated by the Republicans. There's a Republican president in the White House. You have Republican governors in the various states who do not want to alienate the president or reduce his probability for re-election. Then you have Democratic governors and mayors of cities, particularly large cities, that want to maintain the lockdown and the shelter in place because they do see positive results from it. And they realize that if things go back to the way they were 2 months ago, there could be another outbreak that could even be more serious. The hospitals are suffering. They're losing extremely enormous amounts of money. They're even laying off personnel in the state of Michigan and other states around the U.S. Because it's a profit-making private healthcare system. So when you have these type of divisions within the government and various aspects of the government, it becomes problematic in terms of how to move forward and how to rebuild the economy and how to stabilize the country socially.
Absolutely, like you said, a response in the U.S. to this outbreak has been largely partisan. But what do you think can be done to sort of generate a bipartisan approach to this?
It's going to be very difficult. There's a lot at stake in all of this. We're looking at some of the major multinational corporations, and it's not even clear whether they'll survive this pandemic. A lot of the retail outlets in the malls are threatened with closure. Some have filed bankruptcy, for example. So it's a really bad situation. And then with the outbreak in the food processing industry, there are shortages that are developing right now in certain supermarkets. In the pork area, beef, chicken. So it's a real serious problem. In the next few weeks, unless they come up with some consistent methodology, particularly in the meat processing area and other key essential areas of the economy, there's going to be huge food shortages in the United States. And this will, of course, impact the overall public health status of the population as well. So it's going to be very difficult to work out some type of agreement, considering that there's a lot at stake this year with the presidential election, and also congressional and senatorial elections are going to be taking place as well in November.
All right, so amidst all of these food shortages and challenges with employment in the U.S., President Trump has also said he would cut the supply chain, global supply chain with China as a result of that heightened tension between the U.S. and China. How complicated is this making things in the U.S.?
It's very complicated. I think the administration is looking to blame China for this huge outbreak in the United States. We have over 1 million cases of COVID-19 in the U.S. It is the largest outbreak in the world. It far outstrips any of the countries in Europe, for example, Britain, which has the highest number of cases in Europe, Spain, Italy. The U.S. outstrips all of them because they did not take the necessary measures. The White House should have been working on this way back in January and February, and they played it down. They did not want to emphasize the threat that this pandemic posed. And a lot of people in the U.S. right now are suffering as a result of it. The economy is suffering. The healthcare sector is suffering. The food industry is facing enormous challenges. The educational sector, the schools have been closed for the last month and a half, and they will not reopen this school year, and possibly not even until the end of the year, particularly universities and colleges. So this is putting a lot of people out of work, and it's creating a lot of social problems as well in this country.
All right, editor, Pan-African Newswire, Abayomi Nweke, thanks for talking to TVC News.